there are quite a few treatment options for patients when it comes to hair restoration. So let's take a look and talk to us about some of these. And let's start with the hair transplant, because you briefly mentioned it and you said that's a permanent.
Right. Hair transplantation really encompasses both the following two bullet points there, which is follicular unit extraction, follicular unit grafting. Basically, hair transplantation is when hair is taken from areas of the scalp that are not susceptible to hair loss.
So you're using that person's same hair?
Typically we're using hair from the back and the sides.
Okay.
In both men and women, which is not susceptible to androgenic alopecia or hair loss.
Okay.
Because those hair follicles are not susceptible to hair loss, those hair follicles are transplanted, literally moved from the back of the scalp to the front of the scalp or the crown to restore density in those areas that are lacking. Those follicles themselves that are transplanted are permanent.
Okay. Now that obviously is a surgical procedure.
Correct.
Okay.
It could be done either through the follicular unit extraction procedure or through the follicular unit grafting procedure. Follicular unit extraction is a wonderful option now for most patients, which allows for the individual extraction of the hairs from the back and the sides of the head.
Right.
Follicular unit grafting, on the other hand, is the older procedure, but still used quite a bit, where hair is taken out in the form of an incision in the back and in the sides of the scalp. Ultimately, those are what we refer to as donor approaches. So basically, the ultimate outcome is the same, which is taking those hair follicles and transplanting them in the front.
But that's from donor hair.
From the donor hair, correct.
And where does the donor hair come from?
So from the back and the side of the scalp of one scalp. So that's either taken through a follicular unit extraction technique or a follicular unit grafting technique. Follicular unit extraction techniques are when we actually individually extract the hairs from the back and the sides. So you're not left with a linear scar in the back. Whereas follicular unit grafting is when hairs are actually removed from an incision, so you are left with a fine line scar in the back and the sides of the scalp.